H5N1, highly pathogenic avian influenza, has caused infections in poultry in more than 50 countries since 2003 and is a severe threat to poultry production, human health, and to the world economy. As of August 2007, over 230 million birds and almost 200 people have died because of the H5N1 virus. If the current H5N1 mutates into a strain which is easily transmitted from person to person, it could cause a global human influenza pandemic. Experts believe that an H5N1 pandemic could be as devastating as the Great Influenza Pandemic of 1918 and capable of overwhelming the public health infrastructure in most countries, killing millions of people, destabilizing the government in many countries, and devastating the global economy. Planning for the control of H5N1 in poultry and minimizing the potential of pandemic influenza in people is essential for safeguarding human health, food production, and social stability. Biosecurity, surveillance, animal movement control, and producer and consumer education can be used to help control H5N1 avian influenza. Vaccination can also be used to control H5N1 avian influenza. However, vaccination for this disease is more complex than for other poultry diseases. This video has been developed to help leaders in local and national governments, industry, and other organizations understand the complexities of vaccinating poultry for the H5N1 strain of avian influenza. While the focus of this video is the currently circulating highly pathogenic H5N1 avian influenza virus, the basic principles, planning, preparations, and response would apply to other devastating influenza viruses that may emerge. All investments in infrastructure to improve recognition and response to avian influenza will benefit animal health and human health. Vaccination of poultry for avian influenza is costly and burdensome on society and should only be used when there are no other good options to control this disease. Use of vaccination for H5N1 avian influenza has the potential to make the disease situation worse, so adequate preparation is critical. The information presented here is intended to be a resource for decision makers on the use of vaccination to control H5N1 in their country. This video will cover H5N1 avian influenza's impact on public health, animal health, society, and the economy, facts about H5N1 avian influenza and why it is more difficult to control than many other animal diseases, factors to consider before using vaccination as part of a control strategy, the importance of national planning for the control of highly pathogenic avian influenza, how countries with different epidemiologic situations might approach control, and international assistance that is available for control of H5N1 avian influenza. The World Organization for Animal Health, also known as the OIE, and the Food and Agriculture Organization, the FAO, are working with countries throughout the world to control H5N1 avian influenza. The OIE works to ensure transparency in the global animal disease situation and is an important source of scientific information and expertise. The 168 member countries are required to notify the OIE of the presence of reportable diseases, including H5N1 avian influenza. The OIE then notifies all member countries of the outbreak.
Avian influenza is well known from centuries, but since 2003 we got an unprecedented crisis linked with a new strain, is an H5N1 Asian strain coming from Southeast Asia, and for the first time an avian influenza strain was able to cross the continent, and the same strain was able to infect both Asia and Europe, and then Middle East and Africa for the moment. We recommend also to any country. When a country prepare its emergency preparedness plan to be ready to react if the disease is introduced on the country.
H5N1, highly pathogenic avian influenza, is currently a veterinary problem. The virus originated in the wild bird population and is spread by infected wild birds, commercial and backyard poultry, and gaming birds. This virus is spreading at an unprecedented rate. It has infected millions of birds and can affect several other animal species. The OIE and the FAO recommend stopping the virus at its source, in poultry. H5N1 avian influenza is a severe threat to human health. Between 2003 and 2007, over 300 people were diagnosed with H5N1 avian influenza, and almost 200 people have died. People can get infected from close contact with respiratory secretions and feces of sick birds. Butchering poultry and eating eggs or meat from infected birds is a risk for human infection. H5N1 is a new influenza virus for humans. People have limited or no immunity to the H5N1 strain of influenza. Infection usually causes a very severe disease and has a high case fatality rate. Mutation of the H5N1 strain of avian influenza could result in a virus capable of causing a human pandemic similar to the Great Influenza Pandemic of 1918. The 1918 pandemic caused 40 to 50 million deaths worldwide. The likelihood of a mutation leading to a human pandemic is uncertain. There are many questions concerning an H5N1 pandemic that no one knows the answers to. Will a pandemic occur, and if so, when? How severe will an H5N1 influenza pandemic be? Who will be at greatest risk of disease and death? In the 1918 influenza pandemic, and with the current H5N1 strain of avian influenza, it is young people with healthy immune systems who are most at risk of dying. In seasonal influenza, as in the 1957 and 1968 pandemics, the elderly and people with weakened immune systems are most at risk of dying from infection. Will there be major societal impacts beyond human and animal health, such as disruption of transportation systems, the food supply, and other essential services? Will it lead to destabilization of governments? The economic and social consequences of infection in poultry can be severe. An estimated 230 million birds have died or been destroyed because of this virus. All levels of poultry production are affected. At the household level, in rural and peri-urban areas, highly pathogenic avian influenza is a threat to modest livelihoods, food security, and public health. H5N1 disrupts the livelihood of those in the market chain, such as small traders and butchers. It can also cause severe economic losses for commercial poultry producers. The presence of H5N1 virus impacts exports and may result in long-term losses to the poultry industry. H5N1 affects pet birds and gaming cocks and can be spread to new areas as these birds are transported. In some regions, this type of industry is a significant part of the economy and culture. Control and elimination of H5N1 in poultry is more complex than other poultry diseases. First of all, it is a dangerous zoonotic disease which can infect and kill people. This greatly complicates control measures and elevates the importance of control. Second, there is a wild bird reservoir that is very difficult to control. Wild birds may spread the disease without being sick. Third, in many parts of the world, domestic birds are traded without regulations or paperwork to document movement, leading to spread of infection. Fourth, the virus mutates frequently, which can result in a vaccine being ineffective. A new vaccine must be made to match the mutated virus. Another complication is that vaccination of poultry can prevent disease and slow the spread of infection, but vaccinated birds can look healthy and still be infected and spread the virus. And finally, trading partners may refuse to accept imports of poultry products from countries that vaccinate because vaccination can mask the presence of disease. There must be science-based assurance that vaccinated birds are not infected for trading partners to accept poultry products from countries that vaccinate. Because of the severe threat that this virus poses to the world community, a national influenza prevention and response plan is essential for every country. Many government agencies share the responsibility for planning and implementing an effective response to H5N1 in order to protect human health, animal health, and the economy. In addition, poultry, agriculture, and food industry leaders must be a part of the plan as well as other non-governmental organizations that can provide leadership and assistance. Finally, national and international groups must work together for the effective control of avian influenza. The World Health Organization, a United Nations agency, is responsible for leadership on global health matters and is coordinating the global response to human cases of H5N1 avian influenza. WHO provides technical support and is monitoring the threat of an influenza pandemic.
WHO is trying to make sure we don't have the next pandemic, but if we do, we at least want to have some indication of how to deal with it. And so over the years, they've developed this pandemic preparedness plan to give us some indication of where we are and how far we are along the road to the development of a full-blown influenza pandemic. Even with all the activity that's been going on over the last few years, we're still only at pandemic level 3 or pandemic preparedness level 3, where we have no or only inefficient human-to-human transmission of the H5N1. We have not moved to the point where there's strong enough evidence for increased human-to-human transmission to make a statement from WHO regarding the potential for the pandemic. As you might imagine, as you move from this level 3 to level 4 and level 4 to level 5, you have tremendous direct effects on the countries where the virus is found. And so this is not a decision to be taken lightly, but we are trying to avoid what we've seen 3 times in the 20th century, these worldwide influenza pandemics from a new subtype.
How can this disease be prevented or controlled? Tools to control H5N1 avian influenza include diagnostic tests and surveillance, biosecurity, destroying infected and exposed birds, public education, and vaccination. No single tool can control H5N1 avian influenza. A strong veterinary infrastructure must be in place to effectively control this disease. Vaccination is different from the other tools in that it can be useful in some circumstances, but counterproductive or dangerous in others. So why is vaccination for avian influenza H5N1 so complex? There are many reasons. A major reason is that influenza viruses mutate rapidly, and mutation may make the vaccine less effective. Each time the virus infects a bird, it has an opportunity to mutate. High numbers of infected birds give the virus more opportunity to mutate. It may be necessary to change the vaccine to match each mutated strain. H5N1 vaccines do not always protect birds. There are many strains of H5N1 virus, and the vaccine strain must match the field strain of the virus in order to be effective. Also, most vaccines have only been tested in commercial chickens and may not work as well in some waterfowl or in native chickens. Concurrent infection with other viruses or other health problems may inhibit the vaccine from working. There are different types of vaccines for highly pathogenic avian influenza, and each has its advantages and disadvantages. Experts should be consulted for assistance in selecting the best vaccine for each situation. Vaccination of birds can prevent illness, but does not prevent infection. Vaccination can be a very effective tool to help slow the spread of infection because vaccinated birds require more virus to become infected, and once infected, they shed less virus into the environment. However, about 80% of the susceptible population must be correctly vaccinated in order to slow the spread of H5N1. Vaccination makes detection of infected birds more difficult. A system must be in place to detect vaccinated birds that become infected. This can be done with unvaccinated sentinel birds, or through a distinguishing infected from vaccinated animal strategy, also known as a DIVA strategy. Vaccination without surveillance for infection in vaccinated birds can lead to H5N1 becoming endemic in a country. In summary, vaccination for H5N1 is complex because of the biology of the virus and the biology of the birds. There are other factors that should be considered when deciding whether or not to vaccinate for highly pathogenic avian influenza. These include status of infection in and around your country and risk of introduction or spread, poultry production systems, marketing systems, and cultural practices, expense of vaccination and surveillance, the impact on export markets, and the public's reaction to vaccination. Risk assessments and surveillance are used to identify areas at risk of infection and opportunities for the spread of influenza. This information is very important for making vaccination decisions. Different production systems, marketing systems, and cultural practices have different risks. The FAO has divided poultry production sectors into 4 levels based on biosecurity practices and the marketing of birds and products. The prevalence and importance of each sector in your country is a significant factor in the decision to use vaccination. Production Sector 1 includes industrial integrated systems with high biosecurity and birds and products marketed commercially. Sector 2 is commercial poultry production systems with moderate to high biosecurity and birds and products that are usually marketed commercially. Sector 3 is commercial poultry production systems with low to minimal biosecurity and birds and products entering live bird markets. And Production Sector 4 includes village or backyard production with minimal biosecurity and birds and products consumed locally. A major risk factor for backyard and free-ranging poultry is contact with wild waterfowl or other birds. These wild birds can spread H5N1 to new areas or reintroduce the virus to the same area after it has been stamped out. Infected domestic poultry, chickens and ducks, and gaming cocks are also responsible for spread of the virus and have been the source for almost all of the human infections. In closed poultry farms with good biosecurity, the greatest risk of infection is from people, vehicles, and equipment that are contaminated with the virus. Marketing systems are also an important consideration. Live bird markets have been shown to contribute to the spread of H5N1 avian influenza.
One of the challenges, as everyone knows, is live bird markets, where we have a lot of mixture of different species in an environment in which humans are close together. This presents a really unique challenge. So the markets are a place where there's high risk for the presence of virus due to continual mixing of the animals from diverse locations and sources, the presence of multiple species, in addition to many different species of birds often found in these markets, lack of hygiene and biosecurity in many cases, lack of control, overcrowding, and lack of regulatory oversight. So they present a real challenge that the veterinary and the public health agencies should focus on to look at assessing risk and protecting human health.
Restructuring some of the poultry production practices in a country may be necessary for the control program to be effective and economically viable. Consideration should be given to changes in marketing systems, such as live bird markets, segregation of poultry species during production and marketing, changes in farming systems and practices, and increasing the biosecurity of transportation of poultry and poultry products. Cultural practices, such as cockfighting, also impact the decision to use vaccination. Cockfighting and gaming cocks have been directly implicated in the rapid spread of H5N1 in Asia, as well as the spread of exotic Newcastle disease in the state of California in the U.S. Cockfighting involves the unregulated transport of birds across borders, sometimes from infected to uninfected areas. Prize cockfighting roosters are very valuable, and owners are reluctant to allow authorities to kill them. In some cultures, cockfighting is a big business and an important source of entertainment. In addition, there is a well-developed system of illegal movement of exotic birds throughout the world. It has been reported that this industry is using antivirals and vaccines without appropriate authority and documentation. The impact of cockfighting and illegal movement of birds should be taken into account in government plans for H5N1 control. Vaccination takes time, money, and human resources. Time is needed to produce vaccines and for vaccines to induce immunity. Vaccines must be individually administered, and most require 2 doses several weeks apart. It takes several days after the second dose for the vaccines to be effective. Human resources are needed not only for vaccinating birds twice, but for maintaining vaccination records and ensuring the vaccine is appropriately stored and transported. Continuous vaccination can be very expensive. The export market is one of the most important factors in the decision to use vaccination. If the export market is large and is a major component of the economy, the impact of vaccination needs to be carefully considered. Vaccination may limit exports because it can mask the presence of H5N1 unless a very good surveillance program is in place. The OIE sets the international sanitary standards for trade in animals and animal products. Importing countries must have science-based assurance that H5N1 virus is not present. The presence of the virus will stop exports until a country is able to become free of the disease and prove to importing countries that there is no H5N1 virus in poultry in their country. Poultry sectors can be compartmentalized within a country so that sectors with high biosecurity can be maintained free of H5N1, not vaccinated, and can still export products. Discussing these issues with trading partners before an outbreak occurs can improve relations and communications during an outbreak. It is important to have transparency and communication in all aspects of the H5N1 avian influenza disease situation. Stakeholders and the public at the local, national, and international levels must be informed in order to effectively combat the spread of this disease. For example, surveillance methods and the disease situation must be communicated to trading partners and to neighboring countries so they can accurately assess their risk of infection. The public's reaction to a vaccination program also impacts the decision to vaccinate. The public should be told about the importance of eradication of H5N1, the need for mass culling, and how vaccination can help to control this disease. They must be informed that properly cooked poultry and eggs from vaccinated flocks is safe. The public's cooperation with the vaccination and control program is essential for success. The WHO, FAO, and OIE encourage all countries to develop a national plan for preventing, controlling, and responding to H5N1 highly pathogenic avian influenza. The FAO works with countries affected by H5N1 or at risk of infection to strengthen disease intelligence and emergency preparedness. National plans from more than 30 countries can be found on the FAO website. However, many of these plans currently focus on pandemic influenza rather than avian influenza. In developing a plan for your country, the following questions should be addressed. Are there enough well-trained personnel to carry out the control program? Are equipment and supplies available for all aspects of control? Does your country have the diagnostic capability for an effective surveillance program? What cultural practices must be considered? Can the plans accommodate local environmental conditions? Are the laws in place to carry out the control program, including mandatory vaccination and movement control? Will compensation be offered to bird owners, and if so, is a plan in place? Are safe and effective vaccines available? And are financial resources available to carry out the control program? What should your country do to prepare for the eventual introduction of H5N1 avian influenza? First of all, assess the veterinary services infrastructure in your country and enhance it where needed so that the veterinary services can detect and effectively respond to an outbreak. Next, develop linkages among various federal agencies that will be involved in a response.
It's quite complex, highly pathogenic avian influenza, and with it is just not the Ministry of Agriculture, where usually the veterinary services are located. But that's not true in all countries. We're dealing with a potential zoonotic infection of great scale, and so therefore we have to bring in the human health ministries. If we're talking about wildlife, usually it's the Ministry of Environment or Natural Resources. If we are trying to deal with an outbreak and response to an outbreak, the public works or security, police, armed forces are required to assist us. As a trade issue, often the Foreign Affairs or Ministry of Foreign Affairs or Department of State would also get involved. And then there's communication. Communication. It's usually a weak link in any sort of national campaign or even regional and global. National plans and developing strategies that have to be jointly developed and tailored specifically to the type of government, the structure of the industry, the agricultural practices, the terrain, and cater to the nuances and regional differences even within a country, including those traditions that have been practiced for millennia.
In summary, national leaders play a very important role in developing and implementing the H5N1 control plan. They must work with the legislative branch of the country to create laws that will support the development of an emergency response program and the response to an incursion. National leaders must also motivate the public and private industry to develop partnerships to fight this disease. The final segment of this video discusses how the epidemiologic situation in a country influences the decision to use vaccination. 4 different epidemiologic situations will be discussed. Countries and regions where H5N1 is not currently present. Countries that are not infected by H5N1 but are located in regions where H5N1 is present. Countries that are currently infected with H5N1 but that have a very well-developed veterinary infrastructure to deal with the outbreak. And countries that are currently infected with H5N1 with limited veterinary infrastructure and extensive and important backyard poultry production. The first group of countries we will discuss are those that are not currently infected and that are located in regions of the world where H5N1 is not present. Governments in these countries should begin to prepare for the eventual introduction of H5N1. If neighboring countries are not yet affected and the disease is detected early, the chances of eliminating the virus are very good. Early detection can greatly reduce the total cost of an eventual outbreak and reduce the chances of human cases. Vaccination will probably not be needed, and if used, would limit exports. Vaccination should be considered if the outbreak becomes so widespread that killing all infected birds is not viable. Prior to an outbreak, resources should be invested to ensure producers and veterinarians are educated on H5N1 avian influenza. Passive and active surveillance programs for early detection are ready to be implemented. Timely and reliable diagnostic laboratory capability is available. Laws for quarantine, stop movement, and depopulation are in place. Response teams are trained for depopulation, disinfection, and disposal. Supplies for personal protection, depopulation, cleaning, disinfection, and disposal are stockpiled. A transparent and fair compensation program is in place and has been clearly communicated to the producers. A stockpile of vaccines is ready for use in high-value or rare birds. A food safety education program is in place to assure the public that it is safe to eat properly cooked, healthy poultry and eggs and vaccinated birds. The second group of countries are those that are not infected with H5N1 avian influenza, but are in regions where H5N1 is present and is not under control. Governments in these countries should also begin to prepare for the eventual introduction of H5N1. All of the preparedness activities already discussed for countries that are in H5N1-free regions of the world should be undertaken if resources are available. If infection occurs in a country in this situation, the disease can be stamped out if there is a well-equipped and prepared veterinary service. However, the disease is more likely to be reintroduced if neighboring countries continue to have outbreaks. Increasing biosecurity is the best way to control this disease. However, if reintroductions occur, preventative vaccination could be considered for some production sectors. In this case, the sectors to vaccinate depend on a risk assessment and the structure of the poultry industry. In addition to vaccines, the necessary supplies for safely administering the vaccines should be stockpiled. The following factors should be considered before initiating a vaccination program. Live bird markets are at high risk for introduction and spread of H5N1. Consideration should be given to closing live bird markets and/or changing biosecurity practices. It can be very difficult to effectively vaccinate backyard or village poultry and ducks and to ensure that new birds are continuously vaccinated. It is essential to detect vaccinated flocks which become infected and to depopulate those flocks in order to prevent H5N1 from becoming endemic in a country. This can be accomplished by using either unvaccinated sentinel birds in each flock or a vaccine and companion diagnostic test that allow the detection of vaccinated flocks that become infected. Vaccinated flocks which become infected should be depopulated to prevent spread of infection. Some countries may refuse to import poultry and poultry products from countries that vaccinate for H5N1. Zoning, or compartmentalization, according to OIE guidelines, can be used to establish subsets of the poultry sector that are not vaccinated and may be exported. The third group is countries that are infected with H5N1 and that have a well-developed veterinary infrastructure. In this example, both backyard poultry and the export market for poultry and poultry products are often very important. These countries have options for stopping H5N1 without the use of vaccination. Countries in this situation that plan to control the disease by destroying all infected birds should consider the following factors. Reintroduction of H5N1 may occur because of continuing presence of virus in an endemic region. Extensive resources will be needed for surveillance and stamping out activities. Zoning or compartmentalization, according to OIE guidelines, can be used to establish subsets of the poultry sector that are free of infection, have very good biosecurity, are not vaccinated, and may be exported. A transparent and fair compensation program should be in place and clearly communicated to the poultry producers. If the H5N1 virus becomes difficult to control by killing all infected birds, or if it becomes too expensive, vaccination of high-risk areas or sectors can be considered. It is very difficult to effectively vaccinate backyard and village poultry and ducks, and to keep this population vaccinated. Vaccination crews should be trained in how to avoid spreading infection and in use of personal protective equipment to avoid becoming infected. High-quality vaccines, which meet the criteria in the OIE Manual of Standards, should be used. It is important to remember that 2 doses of killed vaccines are required to induce effective immunity, and the immunity takes several days to develop after the second dose. The efficacy of the vaccine should be monitored because the H5N1 virus may antigenically drift so that the vaccine eventually becomes ineffective. Surveillance for infection in vaccinated flocks should be implemented using unvaccinated sentinels or a DIVA vaccination protocol. The fourth group is countries that are currently infected with H5N1 and that have limited veterinary infrastructure for control of the disease. These countries often have a large backyard poultry population, which is an important source of food and livelihood. There are limited resources for controlling H5N1 through surveillance, detection, and destroying infected birds. Resources are not available to effectively implement a vaccination strategy which includes routine surveillance for detection of vaccinated flocks that become infected. The following factors should be considered in deciding how to control H5N1 in this situation. Mass vaccination can be effective in reducing disease in poultry and in limiting human disease. However, mass vaccination is very costly to implement and maintain. Mass vaccination will result in loss of export markets. It is not possible to eradicate H5N1 through mass vaccination alone. It is very difficult to effectively vaccinate backyard and village poultry and ducks and to keep this population vaccinated. Reemergence of infection and disease can be expected if vaccination is stopped or vaccination rates fall too low. High-quality vaccines which meet the criteria in the OIE Manual of Standards should be used. Vaccination crews should be trained in how to avoid spreading infection and in use of personal protective equipment to avoid becoming infected. It is also important to remember that 2 doses of killed vaccines are required to induce effective immunity, and the immunity takes several days to develop after the second dose. The efficacy of the vaccine should be monitored because the H5N1 virus may antigenically drift so that the vaccine eventually becomes ineffective. A new vaccine will need to be produced from each newly emergent strain of H5N1. After the incidence of H5N1 infection is greatly reduced, it may be possible to design an eradication program based on the use of sentinel birds or a DIVA vaccination strategy to detect infected flocks that are vaccinated. Without effective surveillance, all poultry and ducks should be considered potentially infected. People should be informed to avoid high-risk behaviors, such as close contact with poultry and eating improperly cooked poultry and eggs. Closing of live bird markets or implementation of biosecurity in live bird markets should be considered. Vaccination and surveillance programs can be very expensive. The vaccination program itself, the surveillance program, implementation of increased biosecurity, and the compensation program all cost money. Potential sources of funding include government resources within the country, the poultry industry within the country, World Bank Avian Influenza Program, regional development banks, bilateral development agencies, communities of nations, the FAO, and private funding.
And we recommend also to the international community, first, to make available funds for developing countries which are not able to produce or to import vaccine when they need vaccine in the current situation where the virus is endemic, because this is a threat for all the international community. We consider that if we have good vaccines, we will rapidly control the disease where it is, and we will help all the international community to manage definitively this unprecedented crisis.
This video covered the impact of H5N1 avian influenza on public health and animal health, why H5N1 is difficult to control, factors to consider before using vaccination, the importance of national planning, and how countries in different situations might approach control. Because of the risk avian influenza poses to the world community, it is essential that national leaders work within their country to develop a response plan and to secure funding for the program. This video series contains 3 other DVDs to assist government officials at different levels to provide advice and make decisions about vaccination for H5N1 highly pathogenic avian influenza. There are 16 presentations by avian influenza experts on various aspects of diagnosis, response, and recovery. There is also a DVD about diagnostic testing for H5N1 and a vaccine database available on the World Wide Web to assist in locating effective vaccines for H5N1.